Welcome, everyone, and thank you so much for joining us on this session for learning on localization, why COVID-19 wasn't the tipping point it could have been. My name is Manisha Thomas. I am the Geneva representative of the Women's Refugee Commission, and it's my pleasure to be moderating this session, which is a hybrid session. So unfortunately, we have not everyone in the same room physically, but we have many people online in the virtual room. And we've got the chat up so that you can see who's online. And I do invite everybody online to please introduce yourselves so that we know who you are. There's also a Q&A function for those online so they can ask some questions. So I will just do a few housekeeping things. There is that chat function, as I said. Please make any comments in there or introduce yourselves for those online. Those in the room, if you want to log in and do the same, feel free as well. You can use the Q&A button, which is just at the bottom of your Zoom screen, and there you can pose a question. If you see a question that someone else has posed that you like, you can vote for it, so it gets another upvote. And we'll also try to be having some of the panelists who are online answering some of those questions by typing answers, and we will try and answer as many as possible during the session today. So today's session is really very much because when COVID-19 happened, almost right after it was declared a global pandemic, the UN launched its largest ever humanitarian appeal for $10 billion for 63 countries with a global humanitarian response plan. And the pandemic was seen very much as an opportunity for the humanitarian community to start reimagining the way that it generally works. There was lots of us saying, oh, this is a great opportunity for us to really work through local organizations. That grand bargain, the Global World Humanitarian Summit phrase of as local as possible and as international as necessary could actually be coming to light. And the hope was that the response during COVID would show that it could really work that the humanitarian response could work in terms of local and national actors really taking the lead. But 3 years on, we're kind of seeing that maybe that's not the promise wasn't as great as it's turned out to be. We've got a lot of learning, though, and there's lots of evaluations and other sources to see how much we've really been able to manage a more localized response. So today's panel is really going to talk about the degree to which locally led action was realized in two different ways. We're first going to hear about the interagency humanitarian evaluation findings on COVID-19, which included a part on localization. And Andy to my right is going to speak to that, and I will introduce all the panelists as we go. And then John from ALNAP on my left is going to take those findings and apply those to a new analytical framework that ALNAP developed to analyze why localization didn't happen in the response and to understand why that's happened. We're then going to turn to 4 panelists who are online. We've got Jameel, Alix, Mireia, and Marina, who actually Marina's here. So we've got 3 online and 1 in person. And we'll come back to the Q&A at the end. And then John, while we're doing the Q&A and the panel conversation, is going to actually use that framework to complete. He's going to complete the framework and then reflect back to us the discussion at the end of the session. Sorry. So before we get into the findings from the evaluation and the framework in the panel, it is my pleasure first to introduce Laurie Bell, who is the head of evaluations at UNHCR and a member of the steering committee of interagency humanitarian evaluations. And Laurie is going to kick us off with a few words about the interagency humanitarian evaluation of the humanitarian response to COVID-19. Laurie, please.
Thanks, Manisha. Welcome, everyone. Thanks to see you all here this morning. I represent the Interagency Humanitarian Evaluation Steering Group, but I'm also glad to see other colleagues also from the steering group here today. The Interagency Humanitarian Evaluation work has been ongoing for the last decade. A number of independent evaluations of system-wide humanitarian responses have been undertaken, often context-specific evaluations, the most recent one being, for example, the humanitarian response in Yemen. The evaluation that we're talking about today is unique. It's the first time we've ever done an evaluation of a global pandemic. It's unique in that it is a global evaluation. It's not country specific, although there were a number of country case studies that were included in the evaluation, which included over 1,000 interviews with men and women globally, regionally, and at country level. Interagency humanitarian evaluations are managed by evaluation offices or focal points from a number of agencies: FAO, ICRC, ICFA, IFRC, IOM, OCHA, OHCHR, SCHR, UNDP, UNFPA, UNHCR, UNICEF, WFP, and WHO, and ALNAP has observer status in the group. The main purpose of interagency humanitarian evaluations are to promote learning, but also to promote accountability to the governments that we're working with, to donors, and most importantly, to the people we serve. I think I don't want to say too much more about the evaluation. I don't want to preempt Andy's presentation, but I think this evaluation really should be helping us to think about how we could be better prepared and respond better in the next pandemic. So I don't think anybody questions that there will be another one. It's probably a question of when, but I think there's a lot of lessons learned. And I'm really looking forward to hearing the discussion from the panel. Thank you.
Wonderful. Thanks so much, Lori. And with that, I am going to turn to Andy Featherstone, who is a humanitarian consultant who was part of the team that did the interagency humanitarian evaluation. Andy, over to you, please.
Great. Thanks very much, Manisha. Thank you, Lori, and lovely to see all the folks here and online as well. So my task really is just to give a quick sense of the findings and conclusions on localization, so very much focusing on localization from the interagency humanitarian evaluation. Lovely to have an opportunity to do that. So maybe just to kick off with, I've just got 3 slides. So the first one is really just to get a sense of kind of what went right, what were the aspirations, and where were the areas where progress was made. And I guess overall, as folks know, that obviously travel restrictions in place, movement restrictions. So there was a general belief that, gosh, if ever localization is we're going to be able to support it, it's going to be able to come to fruition and deliver, this will be it. And in terms of what went well, a lot of guidance very early on, March, April, May 2020 from the Interagency Standing Committee in terms of how the system can better work with, support, strengthen local humanitarian action. And that included both NGOs, but also governments and other actors. So very positive in terms of from the get-go, having the guidance. And also what was positive was relatively quickly, donors did say, gosh, everything has changed now. We've got to offer the flexibility for agencies to reprogram. We've got to be able to think on our feet. We appreciate the needs to use what exists to really sort of start work and address these very new needs. Also, country-based pooled funds. So pooled funding was pivoted to better support local agencies. And we had the first SURF funding, which not only targeted international NGOs, but also local NGOs too. So some of the sort of positives following the kind of rhetoric. But still what we'd say, and the evaluation concludes, it was a missed opportunity, and trying to sort of understand why, what were the reasons for that kind of, where wasn't action taken? So firstly on decision making, there really wasn't any significant transfer in terms of offering greater power to local actors. So we didn't see local actors be put on a sort of have a greater sort of leadership, reach into sort of leadership, I suppose. Sure, definitely participation in HCTs, in clusters, but in terms of transfer of greater leadership and decision-making power, very limited. Partnerships didn't change significantly. We didn't see power shift in partnerships, still very much the same sort of subcontracting, contracting basis that we'd used in the past and that we're very familiar with. So again, no change. Funding was a very interesting one because, again, surely we know that the international system is hobbled, it can't move. We know that oftentimes, and we have to be, in fairness, the local and national actors also struggled in some contexts to move, but I think it's important to say in many, many contexts, they did move around, putting themselves at significant risk, but there wasn't a significant uptick in funding. There was a sort of modest increase, but by 2021, funding to local actors had gone back down to pre-pandemic levels. So really no real shift. And then, as I said, duty of care. Local NGOs did put themselves sort of at greater risk. We accept that there'd been a significant change in the context, but there wasn't a sort of any significant change or thinking or innovations in around how to protect, ensure safety, and oftentimes to actually just get the basics to them, to allow them to move around and not put themselves in danger or folks that they were working with. So duty of care, again, much sort of business as usual, although actually far greater risk because the context had changed so much. And so where we get to really is there continues to be the evaluation, you know, from a perspective of that year and a half, 2 years of COVID programming, still a need to deliver on these commitments. And so what we saw, again, partnership, there was still that lengthy chain of subcontracting from donors to UN, INGOs to frontline responders. It did actually slow the response down. But it was still business as usual. No significant innovations in direct funding of local actors. Still the sort of old adage around sort of, oh no, insufficient capacity, too difficult, administrative challenges in doing it. So very limited sort of innovation there, or even just saying, gosh, we've got to make this work. So how can we do that? Really largely still business as usual. As I say, with capacity development, disappointing really, because as a system, we've said for years and years and years that we've invested in capacity. Sure, it's felt quite one way, but at what stage, what's the end result of capacity building? When do we get there to a time when we can have greater trust, where NGOs, local actors can have greater power in the system? It feels like it's still a way off, and it certainly did during COVID. So despite the need to perhaps draw a line under some of these issues, limited ability to actually see that happen. And I think overall, a sort of strong perception and a real frustration from local actors that participated in the evaluation, and in the 8 different contexts, 8 different countries that we worked in. We routinely spoke to international government, national and local actors, but a real frustration that actually nothing much had occurred, and nothing much had changed rather. And I'm always can't help thinking back to Somalia, where a sort of very embattled local NGO leader sort of came back and said, gosh, why isn't this changing? If ever there's a time, we had to go to the local business community to get funding so we could start our response. And he said himself, ultimately, money is power. We haven't got any additional money. We haven't got any additional funding. Sure, we're reprogramming, but we can't do as much as we'd like to do. When the money starts changing, that's when the power really starts shifting. So there were some really important messages, both around where the humanitarian community is in terms of supporting local actors, but fundamentally where donors are too. So they're the key findings from the evaluation.
Super. Thank you so much, Andy. And I know that it was a lot to cover in a lot of findings in a very short period of time, but I think it's a little bit disheartening to hear that all of those efforts that we thought, well, we've got a great opportunity with COVID to make those changes, didn't necessarily come true, unfortunately. John, I am going to hand you this. And I'm going to hand over to you, John. And John Mitchell is a special advisor at ALNAP. And John is going to talk us through the analytical framework that has been developed by ALNAP. John, please.
Well, thank you very much, Manisha, and good morning to you all. As we've just heard from Andy, many people were optimistic that the COVID-19 pandemic could create a tipping point for humanitarian action and localization. And although Andy has told us that there's been a significant expansion of certain types of locally led action, the evaluation clearly tells us that this didn't happen to the extent that some people expected or anticipated. So in order to help us explain why this is the case, we're going to conduct an experiment. We're going to use a new model from systems theory to present why this happened, what needs to be done now, and how we're going to improve future response. And you're going to hear more from me about this later, but now very quickly, let me run you through the model. So the key thing about this model, please take a breath. I'll take you through it as quickly as I can. The key thing about this model is that changes and improvements come about from the result of the interactions of factors at 3 levels, which I'll explain in turn. So niches, you can see on the screen here, are where new experiences and learning take place. This is where experimentation happens and new ways of working are trialed. Some are planned beforehand and others spring up in real time in response to emerging problems. We also see all kinds of research at this level, different types of evaluations like the IAHE, action research, and so on and so forth. So these niches provide a test bed for doing things differently. Now, the regime level represents the institutional architecture of the humanitarian system. By that, I mean donor organizations, UN agencies, the Red Cross, Red Crescent movement, international NGOs, all of which, of course, are central to the functioning of the traditional humanitarian business model. Inherent within these structures are established sets of practices, processes, skills, technologies, organizational cultures, and values, all of which, of course, are deeply embedded. And at the landscape level, that's the top level, these are the wider contextual factors that shape the sector and the interaction of actions within it. And here we're talking about international norms that underpin the system, their resilience and relationship with realpolitik and unexpected political and economic changes. And we're also talking about changes, sudden changes in the ecological environment like the pandemic itself, which in turn, of course, go on to affect the wider socio-economic and political context that shape how crises play out on the ground. So, if we put all these 3 things together, we come up with an overall framework that looks like this. Now, if we go right to the bottom there, the time arrow, you'll see that the arrow across the bottom indicates the passage of time. And the various arrows between these 3 levels represent the interconnections between them. And these 3 levels are not discrete spaces, but each one is part of a continuum and they overlap with one another. And so in this way, this framework emphasizes that the process of learning and change is not linear. The 3 levels, just because you have learning at the niche level, it doesn't necessarily mean that you're going to create changes at the regime level. So that's the model. My job now is to go away and listen to the rest of the session and to populate this model with what I've heard from Andy and what I'm going to hear from the panelists in discussion. Then I'm going to pop up at the end of the session with my summary and an explanation of what I've heard. So please stand by. So Manisha, over to you.
Wonderful. Thanks so much, John. And I'm excited to see what you're going to come up with for that model, because it looks like lots of arrows. So it'll be interesting to see what you can pull out from the conversation already. And there was a comment in the chat or sorry, in the Q&A also saying, we should not call findings lessons learned, but lessons that should be learned, because these lessons have been learned, quote unquote, over and over. When will we make learning as compelling and shaping responses as accountability to those in power is? So it's something to think about. I'm not going to
stand by.
Yes, stand by. We will see what happens there. And it's great to see we've got participants from all sorts of different places around the world, including somebody from Bulavinaka from Fiji and Irona Wavu from the Indigenous Affairs Board in Fiji, who were crucial actors during the COVID response, being the entry points to mobilizing operations nationwide along and the trusted nationwide and the trusted institution in Indigenous communities. So again, just kind of reinforcing that we had a lot of local actors that were really critical in the response. So with that, thank you to Lori, Andy, and John for starting us off. I'm going to now turn to our panelists. We have 4 panelists, Jameel, Alix, Mireia, and Marina, and I'm going to be asking the 4 of you the same questions. Can you identify one success of localization during the COVID-19 response? Can you identify one challenge during the COVID-19 response? And what is one priority change that is required? So I'm first going to turn to Jameel Abdo, who is the CEO of the Tamdeen Youth Foundation. Jameel, what's your success, challenge, and priority change, please?
Thank you very much, Manisha. It's my pleasure. That during the COVID-19, I think the one success that we in response to the pandemic is the community engagement. The community engagements improved well during the COVID-19 pandemic response, as all the communities are involved in response, like in the awareness, in the response, in taking the precaution measures, and also in taking the precaution measures, also in the coordination mechanism, also with the local authorities. There was a lot of engagement between the community, local NGOs, and the local authorities in the coordination for the response. The challenge that we faced during the response is there is a limited resources. There was a very limited resources during the response, especially going up to the local NGOs, who has the capacity to engage with the community. They know the context. Yemen context is very various and very difficult to deal with. There is a lot of areas that what's something means something positive in one area, in the other area mean totally different, the opposite. So involving involving the local NGOs, they know about the context, they know about the people beliefs. So there was a very limited resources to this, and this is what make a little bit delay on the response or on the result of the response. Also, what we are going, what we want to know or something for the future is ensuring the local ownership of the response. Ensuring the local this means that giving more priority, more fund for the local NGOs, giving them the opportunity to lead the response, not to be as a side to the local, to the UN agencies and also the international NGOs, because as I mentioned before, they know the context. If they feel the ownership of the response will be more effective and more reasonable. Because what happened, the people will the Yemen context and the behavior of the people, they believe the local NGOs and the local community leaders, they are pretty close to the people. So when they deal with them or when they speak to them, they speak to them in their own language. So the understanding, the acceptance, it will be much better. Thank you.
Thank you very much, Jameel. And I see that you've definitely identified this very similar findings to what came out of the evaluation. Just to come back on that point about having local ownership of the response and to make that change, where does that change need to come from? How can we make that happen?
We can make it happen to give the local NGO lead the response, make them more involved in the coordination mechanism, also involve them in the humanitarian country team, in the response, in the crisis management, also in the crisis management committee. Because what's happened now, you will find only 1 or 2 seats for the local NGOs, and the rest is for UN agencies, international NGOs. So their voice should be here, and they should be more involved in the system.
Super. Thank you so much, Jameel. And I think that
Hello?
point about, sorry, we lost you there for a second, I think. Did you
Yes,
have
okay.
Was there something else you wanted to say?
No, thank you.
Okay, thanks so much, Jameel. I think that point about having only 1 or 2 seats in the humanitarian country team for local or national NGOs really is a sign of how much power you can have in those spaces. And I think we've heard many situations and examples where those NGOs, local and national actors who are present in those country teams don't often feel that they have a safe space to express their views. So I think that is a really critical change that you've pointed out to us. So thank you, Jameel. Next, I'm going to introduce Alix Masson, who is the Senior Advocacy Advisor with the Network for Empowered Aid Response, or NEAR. And Alix, I'm going to ask you the same 3 questions. What's one success of localization, one challenge, and one priority change that you see? Please, Alix.
Thank you so much. And thank you so much for having us on this panel. It's an interesting sort of loop in the sense that we were lucky to be able to contribute, us and our members, to the evaluation in some way. So it's great to be able to sort of share some further elements. On the success on localization, there are 2 ways to look at it, right? One, which is from a global system perspective. And I think that what we have seen as a network is that before COVID-19, when we were trying to enter into the YASC system to bring more local actor voices, it was very difficult for us to do it. And with COVID-19 and the design of guidance to sort of address current situation that had been mentioned for a number of years, right? But suddenly there was a need to have policies around that. So we were able to bring much more local actor voices in that system. So I think that's a success in that sense. Whether or not it has completely delivered, that's another conversation. But opening up the system and having the system to sort of be ready for that, or willing, not ready, to be willing to do that, I think that was a great success. And we've seen it with the guidances that are now available, and that are helping, to push reform, that to push change, not only at the global level, but also within the international system in country. So that is a good element. The impact, I think, is something different. And one of our success, I know it's one, but one of the other success, I think, is that we started to talk about some radical change, which didn't happen, but there was this idea that there was a possibility that because the situation had completely shifted and that the system was not able to function anymore, a radical change bringing ownership to local actors was finally considered in a system that is completely not designed for that, right? Again, we have not seen any of this radicality, but having that conversation was, I think, also a great sort of start in the conversation. In terms of challenges, well, the impact, I think that unfortunately, we don't see a lot of impact from those policies. We don't see a lot of impact from the conversation. And as Andy pointed it out, we even see some of step backs. When you look at funding, which was already direct funding, which was really low, it has gone lower. So where did we miss a step, right? So I think this is a major challenge, right? The fact that there was no impact on all the changes that were seen as necessary, because we know that the next global pandemic can happen. And we know that local actors are still going to be in their community, still being able to respond, the only one being able to respond, but still we are not able to shift or adapt a system to that. And I think that's really problematic. Then in terms of priority,
Alix, we seem to have lost you.
Sorry, in terms of priorities, I'll continue along those lines. Jameel was highlighting the fact that local actors have no space in HCT. Maybe now they have 1 or 2 seats. We have seen that in CBPF. In terms of successes, I should have mentioned that there has been some really great work, specifically in Pakistan, around CBPF, specifically for local actors. What are we doing with those niche elements, as John would mention it? It was a success. So why can't we make it better? Why can't we put it at the system level, for example? Where are we missing that step? And continuing on the international system, we see now with the earthquake in Syria that there has not been any changes in how new operations are set up, like a new response is set up. We've seen it in Ukraine. There are multiple analysis, studies, thought pieces on this. The way of working is not shifting. The system, the international system still works the way it knows how to work. And it
So what would
establishes
you be your priority change there, Alix?
that we reflect on what does that mean in terms of setting up new responses. How do we shift the center of power from the international system to the actual local system, so that it's not an afterthought, but it's part of the establishment? And we had the opportunity in Pakistan, we had the opportunity in Syria, Turkey with the earthquake, but we don't see, well, I'm not even going to mention Ukraine, but we don't see those changes. So we are still fighting the same fight while we have all the tools to make it different. So that would be the system change that we could expect and want to see. Over, thank you.
Super, thanks so much, Alix. Next, I'm going to turn to Mireia Villar, who is the UN resident coordinator in Colombia. And huge thanks for joining us at a very early hour for you, Mireia. I really appreciate that. From your perspective, what is one success of localization during the COVID-19 response, one challenge, and one priority change that you think is required, please?
Thanks, and thanks for having Colombia part of this conversation. We also are closing the loop of having received, part of the evaluation and now being able to share some of our own reflections around it. In Colombia, listen, we had a challenging situation, mostly because we had a combination of challenges of access due to the COVID itself and the lockdown, but also how that gave leeway to many of the armed groups to expand their presence. So that was just the context in which we had to do our work. And luckily, we did have a humanitarian operation ongoing, so we had a basis to work with. And this humanitarian operation had already been working with national partners. One of the things that I think worked relatively well and was successful was the ability to really work with local actors, particularly for the needs assessment and the design of the response. And I'm saying that because we were basically focusing our humanitarian response around the most remote and the most vulnerable populations, both geographically and hard to access due to the conflict dynamics and control. So we really use those communities to give us, remote data collection, whilst we couldn't access as humanitarian, particularly from the UN side, we had restrictions. And that allowed agencies like UNHCR, for instance, with the partners to do needs assessments. We identified the needs of persons with disabilities, girls and women specifically. So rather sophisticated needs assessment that really relied on that base layer of organizations that were already partners to us and that at that juncture became the center of our attention. And this was particularly relevant in places like the Amazonas, where we did not have an operational presence. And that whole COVID intervention really opened the way for us. So I think in general terms, we found new partnerships, we exploited existing ones, and we deepen our operational now post-COVID. The main challenge has been mentioned. There were several, but I think the issue of not changing gears, both in funding and in decision-making, were also a reality in Colombia. We did not receive, as much funding as we appealed for in general, but even when we got SERP funds, we got some $5 million from the underfunded, only 13% ended up channeling through national NGOs. And this is a bit, a concern, and both a concern and an area that we are now lifting as part of the flagship initiative. Colombia is one of the 4 countries worldwide that's going to be toying with and giving a little more leeway to see how we push this learning and transforming in structural changes. Well, that's one of them. As resident coordinator, not as humanitarian coordinator, we manage a multi-partner trust fund on peace issues. So we're really, really, really close to the humanitarian, and we're able to reach over the last 4 years over 600 national, local civil society organizations and channel over $75 million through them. So this is happening in Colombia. What's not happening in the humanitarian, it's a big question mark that I have and that we're going to be exploring. And in terms of one of the lessons learned or things that we think we really need to push forward as well going forward, I think it's the integrality of the humanitarian response. In part because we didn't have the means, the means, the communication means to get feedback from the communities that we were supporting. We had no GSMS coverage in many of the places that we were supporting. We didn't have a lot of feedback as to what they wanted and needed at that time. But in general terms, and post-COVID clearly, communities are asking for much more integrated and robust packages of support. I'm talking of communities that are often confined, that cannot move. So it's not very helpful for them to get one item of our kit or supply chain. They really need to be supported in a much more rounded way. That does make a big difference in their capacity to self-protect. And we're now starting to do some of our humanitarian interventions, particularly from an additional SURF underfunded allocation, whereby we will be arriving in these communities with broader packages of support that include things like mental health or gender-based violence, the typical things that would always fall the cracks when funding was not enough. So we're now putting those items at the front together with our WASH and our health and our livelihoods. But we're really trying to round the offering with all those things that seem accessory or ancillary to humanitarian aid or luxury, and that we're now hearing from communities are very, very important to them. Thanks.
Thanks very much, Mireia. And I think that point you made about the multi-partner trust fund being able to give a lot of money to local NGOs, so why is it not happening in the humanitarian community, is a really interesting one. And do you have any thoughts on why that is?
Well, there was a pool fund, humanitarian pool fund in Colombia. And when the peace agreement was signed in 2016, there was a general feeling of euphoria where the humanitarian community would not be needed anymore. Nothing further from the truth. 6 years later, the conditions of communities have not improved, but we have really suffered a huge decapitalization of the humanitarian community. And one of the losses along the way was that fund. So the pool fund for humanitarian support was done away with. And we're now, again, in the context of the flagship, really wanting to see what is that we need to reestablish, but a sense of decapitalization that has made then our ability to respond a lot harder. Once you lose some of these assets, are very, very hard to get back.
Thanks very much. And I think that the fact that Colombia is one of the 4 flagship countries of the Emergency Relief Coordinator, where you've got 3 years to be able to change the system as you wish. So almost in a way, putting into practice what Alix was saying is that how do you set up a response in a different way where you're really able to shift the power? There's that real opportunity there. And I'm going to come back to that in the Q&A a little bit more. But I want to next turn to Marina Skuric Prodanovic, who is the Chief of the System-Wide Approaches and Practices section at OCHA. Marina, what's your one success of localization, one challenge, and the priority change that you would like to see?
Thanks, Manisha. Always hard to choose one, but let me try. So first, I want to preface this by saying that as COVID fades from our collective memories, let us not forget it was a tragedy for millions, but without it, it was still, and without also wanting to sound glib, it was a huge logistical inconvenience in terms of how our systems are set up to react. So in this environment, we had what I would call, maybe marriage of convenience is not the most adequate term, but an arrangement of convenience where there was a recognition of the role of local actors in a way which perhaps never occurred before. And I think in the midst of this, a compelling narrative developed in an environment which I think was also sensitized by the Me Too movement, talks about post-colonial humanitarian system, etc. So I think the fact that the system was vulnerable and the infallibility of the systems we have and that we assume will always function, did not function, perhaps made us a little bit more humble and allowed us to recognize and make space for a better and stronger recognition of the role of local actors. And that made for, I think, a good narrative. Whether that narrative changed things significantly is a different issue. So perhaps, and I consider that a success because it did pry the door open. And I think Alix reflected on that in a slightly different way. And I think allowed us to make some policy changes, which to me is a success. And while the tipping point was not a tipping point to the point everyone expected, you know, I think in my eyes, change is incremental. And yes, it's nice to have revolutionary change, but a lot of changes is very much about incremental steps. And I'll get to that also more in the answer to the third question. So that was the success. The challenge was that, you know, the magnitude of the crisis took us all aback, and the capacity strengthening that we should have conducted ahead of time as part of preparedness and other measures did not actually take place. And so when we started talking about capacity strengthening in a situation of crisis, that's a really hard thing to do. It's hard to, yes, you learn also, crises help you learn, but that sort of more structured capacity strengthening did not take place. I think it's also the fact that we had not pre-planned and looked at different situations, and nobody really could predict the magnitude of the pandemic. But still, I think we need to really look at, and I'll come, you know, turning a little bit to learning, how do we do capacity strengthening in a very situational and holistic way? So it has to be both situational but holistic in terms of looking ahead. So while we were unprepared for the scale, I think we need to have forethought. And the challenge was we didn't. We also did not really balance out the competitive advantages of, for example, logistical systems, supply chains, cold storage, which was more about local and national governments, but also other types of roles that NGOs were really could critically fulfill, and in a much better way than perhaps the international actors could. So I think the end result was that strengthening was not there. And hopefully we will learn, and turn back to the first question that was asked by one of the participants, will we learn? I hope we will. And I think there are things moving, but that was, I think, to me, the key challenge. And then in terms of priorities for change, I think some speakers have already reflected on membership in humanitarian country teams and so on. For me, leadership and the power sharing of leadership is really critical. We have participation. We know that more than half of the participants in coordination bodies are local and national actors. It is the leadership that is critical, having that power to really change things. And the existing system that we have is really a result of decades of unequal power relations. It's ossified in policy and practice, but also attitudes, either explicitly or implicitly. And beliefs and attitudes are the hardest thing to change. We can change some elements of certain things, but if you actually don't change that belief and attitude that drives everything else you do, that's really difficult. I was reminded of that yesterday. There was a colleague from Ukraine who was saying, we hire people based on beliefs, and then we assume they can learn everything else, right? And I think that's true. And I think we need to challenge ourselves. What are real beliefs and attitudes? And that will also drive that change in terms of power sharing. I said in the answer to my first question, the first question you asked, change to me is incremental. It's, you know, there are various theories on how change occurs, but I'm a firm believer in data. And I think we as OCHA have also been collecting data to drive that change and showing whether there is progress over time. But most people are actually not convinced by data and figures. They're convinced by inspirational examples and evidence. And I think for me, gathering that evidence on how the changes that do occur in the power sharing actually really make a difference in the assistance we provide is really critical. And that's what's going to inspire us all and aim to do better and perhaps and hopefully share a little bit more. And then finally, in terms of power relations, I think, you know, we're looking at systems which are, we're looking at international assistance. And we also should recognize there are many places where response occurs without any international actors. Somebody once quoted that something like 60% of emergencies actually have no international assistance. So let us not forget, we do have local actors doing this all the time. Perhaps it's not on the international radar, but it's there. And we've also been shown that by various emergencies in Asia, where local national governments have been fully in power and have not wanted international assistance. So let us remind ourselves of that and be a little bit humble. It's not just about the orbit that we inhabit. It is a much larger orbit.
Super. Thanks very much, Marina. And I think that point about leadership and power sharing is something that we've heard not only in the context of localization, but also when we talk about accountability to affected populations and how do we even bring our frontline staff into the decision-making, or, you know, those who are in contact with affected populations on a regular basis. And then when it gets to local organizations, it becomes harder. And that point about capacity development and how we don't do it in advance. Talking about things that we don't necessarily learn, that's something we've been saying for many years. You know, we always say we need to do better capacity development. Why is it, do you think, that we're not prioritizing that?
I think because many people see it as a luxury. It's a plus, but not a must. We are very, I think, about input output, sometimes pressured by donors. I think on the upside, there is a recognition by donors too that capacity strengthening is extremely important. But certainly, I've worked for a lot of organizations, and capacity learning comes as an added bonus, not necessarily the starting point. Except in the private sector where it's often the starting point, because it helps you gain that competitive advantage over people you're actually trying to beat in the market. I think in the nonprofit sector, we see it a bit differently. I think we're learning and we're moving. It's not all negative, but definitely I think it's often seen as a bonus rather than an integral part of our response and who we are.
Super, thank you very much. And I think it was interesting also in the evaluation and localization element that you pointed out, Andy, that there was a lot of focus on the capacity development needing to be about building the financial capacity, because a lot of times the reason that it's felt that local and national actors can't get funding directly is that they don't meet the demands of a lot of donors. And that issue about risk management and risk sharing is something that comes up repeatedly when we're talking about localization and being able to make funding go more directly to local actors. And as Jameel pointed out, and as well as Mireia, you know, there wasn't that ability to really fund local actors more directly. And even if there are limited resources, they were mostly going to a lot of international NGOs, and we've seen the funding decline. What can we do to sort of shift that balance of that risk sharing so that it is easier to give money to local organizations much more? And there's also a question in the, or comment, I guess, in the Q&A around even with our system, we also, it's hard to learn from local actors because the system, quote unquote, believes it already knows the priorities and has the necessary frameworks in place. But local actors often have unique insights into priorities and have and issues that the system may overlook. So if you have evaluation processes that only use standard criteria and questions, they may not fully recognize the value of localized responses, which may reside in areas that the system is unable to see or even access, as you just pointed out, Marina. So we need to bring back voices and curiosity also back into evaluative exercises. And so I'm wondering if anybody's got some thoughts on either that one around the evaluative point or also around, you know, this risk sharing and how we're able to kind of find ways to better share risk so that local actors can get more funding. And that initial question that I'd pointed out just after John spoke is, when will we make learning as compelling and shaping responses as accountability to those in power is currently? I don't know if anybody online maybe first wants to come in, and then I'll come to those in the room. Jameel, Alix, Mireia, any thoughts on those?
I can come in. And because what you're mentioning makes me think of what's happening in Colombia. We have the first progressive government, and many of the people's communities that were in the periphery, that are still in the periphery of the country, are now governing. And so there is a huge conversation about the ability of local structures. I'm not speaking of local government, but you know, indigenous groups, community leadership, to really manage state resources. So it's a conversation that I think resembles very much, and we just need to let go. We need to empower them and equip them to be able to do that and put the risk management elements that may be needed. But if we have a state that's devolving resources, land, transfers, and the capacity to contract, why can't these same communities do the same on the humanitarian front. So if we're not careful, we may have a situation with the government, and this is not going to happen overnight, but where the state is more trusting of these communities than we are as international. And yes, there is corruption and there are problems and there are capacity gaps, but I just think the direction of travel, no doubt, is where when we just going to have to let go.
Super. Thank you very much, Mireia. Alix or Jameel, did you want to come in?
Yes, very quickly. I love the example that Mireia has been putting forward. I live in Kenya, and the same is happening in Kenya. And it's really interesting to see how international actors have been struggling to actually adapt their own programming, their own thinking in working with a much more devolved power within community. There are many challenges as well, but I think that this is a trend that we see, right? And you know, when we talk so much about capacity, sub-capacity learning, risk sharing, I wonder if we ever question, why is it posed this way? In the sense that indeed, after 20 years or 50 years or 10 years, how come this is still not working? Maybe we're just not asking the right questions. We're not looking at it from the right perspective. We're trying, and I was writing that in a Q&A, we are trying to fit in a system, very contextualized ways of working. And of course it's failing. So at some point, are we able to think a system that would be able to cater for that? And John was talking about niche. As near, for example, we started to pilot different ways of working, different ways of funding local organization. I know Tamdeen, we did that with Tamdeen as well, not with Tamdeen, with some of our other members, where we established a global fund where power belongs to local actors and where they are directing and choosing where we act, where we open the fund, and where there is a need for a crisis, and how the money is spent, and with a very, very limited due diligence, thorough, but limited. And it seems, I mean, we are still waiting for the first result, but it seems to work. And so the risk aspect, it seems that we're getting towards the idea that the risk aspect is not a problem on operation. It's a problem on policies, and it's a problem that belongs to donors and that belongs to intermediaries, but that doesn't really belong with local actors. But we keep on bringing the conversation on their capacities to be able to handle that risk sharing, while they have nothing to do with it. So I think this is also hard to sort of start reflecting differently on what we are trying to achieve there and what are the issues at stake. The issues at stake, for example, when talking with donors, often is their own trust with their citizens. That's really often what comes back in the conversation. How do we justify? Then maybe that's where we need to sort of start thinking and support donors in their thinking, not so much in how they operationalize their humanitarian, the aid system in general. It's just a thinking. I'm not, you know, it's not a very well backed up evidence type of conversation, but it's really based on the I would say now this one, the hundreds of conversation in the last 3-4 years, and where we are running a bit in circle, you know, and so is there other ways to address those conversations?
Thanks very much, Alix. Jameel, I'm going to turn to you before I
Yes.
come back to the panel, please.
Okay, thank you very much. Just what we are looking for, not like omitting the due diligence or omitting just simplify it. I'm pretty sure that 99% of the local NGOs, they have the capacity, they have the required, the minimum requirement for getting direct fund. But the due diligence process is too complicated for them. Even though there is some questions or some requirement is not even applicable, or even it's not even applicable for international NGOs rather than local NGOs. I just try to emphasize what Alix mentioned, that NIR has the experience of this, and this was done during the response to the earthquake in Syria and Turkey. And I think they mobilize the fund, they mobilize and they make the local actor lead this whole fund and give the direct funding to the local actors. And this the fund they make the fund they made also they led by the local actors. And from the feedback that we received last month in the MENA region meeting with NIR, that they mentioned that there was very successful, and also even though it's more effective, because the people who is running or steering this fund, they know about the local context, they knew about the priorities, so they directed the fund to the to the areas where there is a crucial needs on. Thank you.
Thanks very much, Jameel. I'm going to turn now to the panel. Lori, Andy, Marina, the in-person panel, sorry, not the online panel. Who would like to go first in response to those questions? Andy, please.
Yeah, I think I would echo what Alix and Jameel have both said, that we talk about localization, local actors, and we talk about upending the system, but we pick and choose what bits of a system we want to upend. And there's something that's deeply problematic once you start talking about risk, and whose definition of risk. It's sort of our definition, the international system's definition of risk. And there's probably not, and there isn't enough work on trying to understand risk in a localized context in those actors who work in these complex environments. And I think there is some work going on with the START network, with NIR's Change Fund around this. But again, it is about turning the discourse on its head, not just the sort of aspects that we think might be okay, but actually across the board. And that is part of shifting the power. And that is certainly an issue which the evaluation was fairly strong on, that actually you can't pick and choose. If it is about changing the system, we fundamentally need to change our way, or the lens we use to look at all of these issues, whether it's risk management, capacity building, whose perceptions of capacity building, whose capacity, who should decide what that means. So it's a sort of extension of supporting local humanitarian action and not trying to limit it, but embracing the fact that the agenda needs to shift, I'd say.
Thanks very much, Andy. And there is a comment actually in the Q&A from Silva saying local actors do have leadership, local actors do have capacities, simply they are not allowed recognition by the system of this power and capacities. We do not need more capacity building at the grassroots to play by the book. We need collective learning and power sharing to harvest what is already existing and not tapped on. And I just, before I come to you, Marina and Lori, because maybe one of you can also answer this, there's a question from Corey at IFRC about discussions about power imbalance in the humanitarian ecosystem is not new. Surely there have been some changes, progress, lessons learned on these, and it would be good to know know what these are, where we are, and how practically we can move the needle on this. Yeah, Marina, can I go to you first, please? Lori just said for me to get, Lori said go to Marina first.
All right, so why don't I do try the risk first, and then I'll go on to the power sharing. I think on risk, and I agree with everything that my fellow panelists have said, so I'll try to add perhaps slightly different elements. To me, there are two types of risk. One is, well, there's transference of risk, obviously. There's the risk of fraud and the risk of counterterrorism. And to me, these are two quite distinct pillars, because I think donors and political constituencies are slightly different and they react to them differently. So I think that's the starting point. And somehow, in terms of appetite for risk, I do understand the donor perspective of being accountable. I agree with Alix, maybe we should be doing more about engaging and widening that dialogue. I think it often ends up being a very simplistic thing. People give, you want money, you are responsible for the money, somebody embezzles funds, then it becomes a problem. To portray the sort of complexity of, look, we take risks, we work in risk environments, there will be risk associated, it will not be risk-free. it's a complicated message to send out into a wider public sphere. I'm not demeaning the public sphere. I'm just saying that we are often, we are functioning on sound bites based on Twitter and other places. So that complexity and having that complex debate is difficult. Second, I think there are the political election cycles, which are what they are. Making changes in legislation and so on is a long-term project and takes often 4-8 years. And if you are on a 3-year term, you'll evaluate that perhaps that's not in your interest. So I think there is that element too. But certainly I think there is space for having that more complex debate. Counterterrorism, I think on fraud it's easier. Counterterrorism is really hard for very obvious reasons and the world we currently inhabit. And to me, that's really where the whole system is going to have a real challenge in dealing with it. But certainly, I think, look, agree with everyone, we know that we transfer risk. I think there's been a few glimpses of hope. There's been more risk appetite on the part of UN agencies. And, there have been UN agencies who've now done small grants, which is one of the things where you can actually allocate to communities more directly. There's been more opening of these possibilities in the last year or two. And to me, that's a positive development. Now, in terms of overall scale, let's be honest, this is not going to bring us to move from the 2 to 3% of total humanitarian aid that is actually given directly to local actors, which is paltry. So we're not going to bring scale, but are we going to bring other things? Is it going to bring a sea change? I don't know. So that's on risk and transfer and financial funds, etc. The second point about power balance. Look, I think this is a whole separate discussion. Power balance and imbalance actually manifests itself in so many ways. So people are very focused on humanitarian country teams. To me, the real power actually goes lower because it's all about allocations that occur usually at sectoral level or cluster level, whatever you want to call it. And there we see a bit of a move and positive indications and some progress on this power sharing. If you ask local actors, it's still insufficient, and I agree with them. And these discussions take place in different fora, but I think you need to look at it also in different segments. So CBPF advisory groups, advisory boards, not the definitive thing and not where all the money gets allocated, but you have local actors present in all of them, which wasn't the case 2-3 years ago, right? So here's some progress. Can it be more? Of course. HCTs, it's sort of waivers. It's a more complicated discussion. We can also have discussions about some really positive examples like Gaziantep and so on, where we know that there is a much greater participation by local actors, but it also changes the nature of these forums. It's a sort of more complex debate. But I do come back to leadership, especially in clusters, sectors, because I think this is where the real decisions on funding get made. And to me, we need to do more on this. That's really where the area of change should be. Back to you, Manisha.
Thanks very much, Marina. Lori, I'm going to turn to you, and then we've got some more comments and questions in the chat after that. We'll come for another round.
Thank you. I'm actually not a panelist. I was just opening today, but it strikes me. I said at the beginning, this was a unique evaluation because it was the first time we'd done an evaluation of a pandemic response. And I realized as people were talking, it's unique in another way. It's the first time that through the lens of evaluation, we've looked in any systematic way at localization. So going to Marina's point about accountability and that organizations have signed up, have committed to working with local actors. One thing that I take away from this conversation is that we as the steering group for the Interagency Humanitarian Evaluations need to think about how we're going to look at the way in which the international system is engaging with local actors and in the context of the response and in the context of the evaluations that we do of that response. And I thought to myself, how many evaluations have we done in the last years that have given any real focus on what the community's response was? So if you read the evaluation from Yemen, it's all about what the NGOs did, the international NGOs, what the UN did, and there's very little on what local actors did. And it points to the issue of relevance and appropriateness. So if you're not looking at what the local response is and the local capacities are, how can you tell if the international community is doing the right thing, is being proportionate, is being complementary, building on the response the local response. So really, from my side, a couple of key takeaways, and I'll be following up with some of my colleagues after this session.
Super. Thanks very much, Lori. So it's great that you came in at the last minute as a steering group member to come in. I'm going to take a couple of questions from the floor as well. And just wanted to read one comment before I do that. INGOs from FASA, who says INGOs need to look back into how they have been doing capacity building before the localization agenda was rolled out and systematically adapt to the localization needs. Then the capacity that most INGOs were looking for was largely to do with the ability to manage subgrants, which has a very narrow focus. Localization capacity needs to include risk management, management systems, and program development capacity. So I'm going to now turn to the floor, and then I'll come back to I think I've got one more question in here. I'm going to go with Shruti, please. Well, actually, introduce yourselves, please, then in the second row here and then there.
Thanks, Smriti Patel from Global Mentoring Initiative and A4AP. Thank you for the presentation, very interesting findings, especially around, I feel like we talk a lot about risk all the time, but where is the trust centered in all this? If we're really serious about making progress, trust needs to be more at the center than risk, talking about risk the whole time. And I think the second point is that if it feels like all the discussion is centered on the international system rather than focused on affected populations and the local system. So in a way, all our recommendations and everything is to improve the international. So it's all the focus is on international. I think we need to be much more centered to the local lens. So I wanted to ask the question in Andy, when talking to the especially from different countries where the case studies, key element, did the conversation on trust came in, and did this conversation about how do you make sure that it's really centered on local level capacities and collective capacities at local level going forward? Thanks.
Thanks, Shruti. Aya from WFP, please.
Yeah. Hi, everyone. Thank you so much. Super interesting and very informative discussion. So mine is more of a comment. I mean, it's not direct question, but
Can it be a very brief comment though, please? Because I want to make sure I get questions, like really,
Small.
it's about questions, not so much comments.
okay. Well, let me reverse the question. So if we're saying it's about power and it's about money, we are missing the donors in this discussion, right, today. So why don't we try to turn it around and do an analysis of the funding? Because we have been constantly reminding that we are donor dependent, we're depending on the funding. There are structures in place that are very complex and may not allow direct funding. So instead of turning the angle on us, shouldn't we also be doing a proper study that will give us the right data to help move us forward in this? And one more comment on that, or question, if we may, is context is now more relative than ever. And I've been thinking about the last 2 days. So how do we put that in as well? Thank you.
Super, thank you very much. And in the white shirt back there, if you could introduce yourself, please.
Sure. Hi, Lucy Puentes, Start Network. Just a quick response to that one. I think that donors are sometimes this sort of monolith that we refer to, and just as maybe it's a little simplification. We have a number of donors at the START network that enabled a pilot that launched in 2020 to allow funding to reach local actors in anticipation and response to COVID-related crises. Irish Aid, Netherlands Ministry of Foreign Affairs, and Jersey Overseas Aid. So there are donors who are prepared to try new things and test new approaches. That COVID program that we had led to a number of local national actors who had gone through a tiered due diligence framework, who would not otherwise have been able to access funding, to start accessing funding. Many of those organizations have subsequently gone through further due diligence assessments and have been allowed to access much larger sums of funding. So I just want to say that I think donors are prepared to be forward-leaning if we put it back to them, and it's important that they're part of this conversation. But I also just want to I guess it's a question on this issue around capacities of local actors, which has come up in this presentation. And again, just this status quo that we seem to maintain where international actors are the experts, and what is the exit strategy for that? I'm going to refer to just quickly one example in Myanmar.
Just a question, please, because I've got one more
Sure.
question.
In Myanmar, there are examples of Trokara shifting the prime to local national actors with the support of FCDO. And I would love to see more of those sorts of examples of positive changes that have happened with the support of our international intermediaries that would maybe provide some kind of, hope for other international organizations that they might move in that way. So I'm just curious to know if other examples of internationals acting in a way that was positive for local actors have been surfaced through this.
Thank you very much, Lucy. And one last question, and please, if I could ask you to make it brief so we've got time to get answers.
Yeah, absolutely. Matt Ellingson with Compassion International. I'm curious for the panelists, are there any examples anywhere that we know about of local organizations doing an evaluation and assessment on INGOs and the multilateral community on their capacity to partner that way for an actual two-way knowledge transfer?
Super, thank you very much. And we also have one more question in the online saying, is the point of insufficient capacity real, or does the system need to rethink what capacities it expects during a response? Is it expecting for local responses to respond like the existing system instead of allowing the local responses to lead based on community need? And I think that's very much similar to the comments that were made before, how are we actually looking at the perceptions of what is required in this focus on the international one. So the question around where is the trust versus risk, the issue about donors and having a study there, is there an exit strategy for international actors and any examples? And are the examples of local actors, doing evaluations of INGOs or the international system? Maybe I'll go online first. And then also once you've provided an answer, if you have any last words, please give me those as well, because I'm going to invite John up in about 5 minutes. So please keep your answers quick, please. Jameel, do you want to go first?
Yes. What I mentioned that the trust against risk. Yes, we have to be more optimistic, not because now all the talks about the risk, but not the trust. So I think there is a trust, but the system itself is not considering this trust. It's considered the risk, more the risk. Also regarding the local capacity, I think there is a local capacity to do the work, but I think the system doesn't want that. Thank you.
Thanks very much, Jameel. Alix, please, and then Mireia.
So many different points. In terms of
pick one or two.
In terms of exit strategy, you may want to check in with Trocare. They have done great work in different countries. And I think that has driven part of their localization work. So not my place really, but I think that's a helpful sort of place to look. In terms of trust, it is at the core. I think power and trust are really difficult, complex, right? But what we try to show with the Change Fund is exactly that, is that if you trust a local actor to make the right decision, as we do, or as the fund does, and to know where, what, how they need to act, then the reality is that you get pretty great results. And that, so hopefully those are the kind of niche work that we and others are driving, that hopefully can get a space in the system. And I didn't catch the name of the person, but yes, I think donors are not a monolithic space to engage with. And there is an element that we didn't really talk about when it comes to funding and localization. There's an element of scale that is very problematic. So there's an element of scale. How do you replicate some of the niche work to allow volumes to move? Because that's really what donors want to talk about, how to get volumes to move. And how do we not replicate the power imbalances within the intermediary system?
Wonderful.
So I think, yeah, over.
Thank you. Just because we're running out of time, John, I'm going to invite you to come up because I'm going to come to you in hopefully 2 minutes. Mireia, please.
Thanks. Maybe I just want to bring something to the picture. We're talking localization, and I know it may be anathema to the humanitarian point of view, but it's the government. In a country that is an OECD member like Colombia, and even though in terms of the financial resources that we as a country team bring are about 50% to the budgets that they manage, the capacities to scale up a response to COVID, for instance, or the capacities and the assets they have to really protect people are a lot larger than what we will ever have as a humanitarian community. So I would like to put in this conversation also these opportunities that we have to work particularly with local government, which are the first responders, who are tremendously weak, who we don't fund, and who we don't assist to interact with the rest of the community. So there is a full agenda there in terms of the state capacity to respond. And I realize that that's not everywhere, but I'm speaking from the perspective of Colombia, that we're missing. We're so focused on how our parallel system will work that we're missing the elephant in the room, which is the state capacity to do its job. So anyway, I have a lot more to say about that, but I wanted to at least plant the seed.
Thanks very much, Mireia. Marina, Andy, Laurie, do you want to come back on some of those questions briefly?
Perhaps I'll just quickly, particularly on Smriti's question, perhaps just to say, I think the issue of trust was a really important one. In the context of a COVID response, it was particularly difficult because not only were there the usual fault lines, but also because of movement restrictions, almost everything was virtual. So it was a terrible time for trust. I think what was quite interesting is if we're talking about shifting the power, both giving power up, but also taking power, what we did see was certainly a large number of quite empowered local and national NGOs, albeit quite frustrated, who were sitting in a similar room, albeit a virtual one, and did feel that there was growing trust. So if you want to say something positive out there, there have been steps to bring the system closer together, albeit with work still to do.
Thanks very much, Andy. Marina, please.
Okay, I'm first going to self-correct. I talked about 2 types of risk. There are, of course, others such as PSCA, which I've not forgotten. Should somebody respond to that? This is in relation to my previous statement. 2 points. One is, look, there's always this creative tension between predictability that standardization brings and adaptability to local context. And I don't think there is an easy answer to that. I completely take the point that one of the participants said, you know, what about, you know, the way we locally respond, etc. It's hard to have it both ways, right? We have standards, we have sphere standards, we have multitudes of different benchmarks, which allow us to have a predictable and standardized way of giving assistance. That always has to be balanced out. It means there's probably a limitation to how much you can go to fully localizing responses if you're expecting international assistance. I think to me, that's perhaps one thing to consider. And then lastly, on the question, I don't know of any such evaluations. I just know of certain evaluations and studies where local actors were asked about international actors' capacities, but not a structured evaluation as such. Here's a thought. We have evaluation colleagues in the room. What if the development and humanitarian evaluation experts, not just humanitarian, because I think to me capacity is larger than humanitarian, it also goes into development, where to get together and do a joint evaluation, a few case studies of how does that look? Wouldn't that be challenging? Wouldn't that be putting the system a little bit upside down? So there's a challenge to Laurie, not to put her on the spot, but you know, maybe something that could be taken to evaluation experts. Over.
Thanks very much, Marina, for that very concrete suggestion. I won't put you on the spot, Laurie. I'm going to now pass to John. Thank you to all of our speakers. I'll definitely thank you more properly at the end. But John, you've gone away and taken that analytical framework, listened to the conversation. What did you come up with?
This is what I came up with. Thank you very much, Manisha. So
Can we put the PowerPoint up, please? Oh, it's coming, okay.
It's coming, it's coming. Well, look, I've been listening carefully and I've tried to populate the 3 levels of this framework with what I've heard. I did have, I cheated a little bit. I did have a little bit of background information beforehand. So I've combined with what I've heard with some background information. But hang on to your seatbelts because we haven't got long, have we? So I'm going to have to rush through this because there's a lot to get through. So I'm going to do it quickly. That's not the right slide. There we go. So let me run you through the summary of what happened, why it's happened, and what steps we need to take to improve further response. Let's start at the landscape level. The main headline from the landscape level is well before COVID-19 was declared a pandemic, there was a fundamental mismatch between the rhetoric on localization and the way that the system, the structure of the system is set up to respond. So if we start with the rhetoric, which is something that Marina mentioned earlier, we saw the emergence of the decolonize aid debate following the Black Lives Matter movement. And this, of course, brought to the fore the long-standing discussion about unequal power relationships between local and international actors. Alongside the talk, we saw a normative shift in favor of locally led action, specifically the Grand Bargain, of course, aiming to provide 25% of humanitarian funding, as Manisha said, as directly as possible to local and national actors by 2020. So we know that the gap between rhetoric and reality before COVID started was considerable, because in reality, as the State of the System report tells us, funding structures and funding flows had remained the same up to that point. There'd been no change there. And that gap has become embedded. It's got deeper for many reasons, including incremental increase in the level of bureaucracy, which is something that Jameel mentioned, scrutiny of public funds, and this has contributed to risk aversion and perverse incentives amongst donors. I'll come on to this in a minute. And I've taken a quote from the State of the System report here to summarize this. The challenge is the willingness to let go and the fact that most of the international actors, whether they're donors or UN agencies or international NGOs, don't have the incentives to let go. And until that incentive structure changes, I don't see much change happening. That was a senior figure in the system before the pandemic. And this issue of trust has come out. We've all heard of it. Jameel mentioned it. Several other people mentioned it. And as Alix said just 5 minutes ago, trust is a prerequisite for great results. And also there was a lack of evidence, robust evidence to demonstrate the feasibility and viability of local action. Andy told us that there was no evidence of donors funding innovations. And we know that the absence of evidence acts as a brake on trying out new ways of working. We also heard from Marina, I closed it there, but I can't remember exactly what the quote was, but she believed very, very much in the power of evidence. There's not enough evidence to show the feasibility and viability of locally led action in all situations, and that acts as a brake. So these barriers to change ultimately add up to a mismatch between ambition and hopes on localization. And the structure and culture of the system before the response was simply too rigid and inflexible to enable deep changes in operations. So if we go on to what happened at the niche level, this is the area where new experience and learning takes place. So because of what I've said about the landscape, what we saw on the ground was predictable. It's predictable because the system is capable of some surface adaptations and flexibilities. And so it was no surprise to see the significant expansion of local actors that most of our panelists have talked about. And partly this is because local actors have been at the forefront of humanitarian action long before the pandemic. And this reliance simply increased, as Andy said, during the response, especially for those international agencies who had long experience of partnering with local organizations. And Marina mentioned here the importance of incremental changes. People expected transformational changes were going to be disappointed. Marina might be quite happy because she has seen incremental changes take place. What they're going to add up to in the future is another matter, but they were there. We saw many gap-filling examples from local actors, and we heard from Mireia in Colombia, the work on gender and on health and on needs assessment. And we know from the IAHE evaluation that there was a lot of local action outside the formal system. There were sensitization activities, voucher programs, shelters to people in quarantine, all from local people. Local communities and leaders also played a key role in addressing misinformation about the virus and promoting uptake of the vaccine. And as Andy very importantly pointed out, we saw some tweaks in the funding models, and these were favorable to locally led action. The IASC policy guidance, which Andy mentioned, which Marina mentioned, encouraged the use of a country-based pool funds, and they were successfully leveraged to put more funding in the hands of local civil society. And although this represented a small proportion of total funding, it still shows that country-based pooled funds have an important role to play in changing traditional funding flows. And so in general, we saw that funding was becoming more flexible, with donors agreeing to purpose or repurpose or pivot existing funds to meet emerging needs. And some local actors reported that they found it easier to receive funding during the pandemic, and that enabled them to respond more flexibly to emerging needs. But as Jameel told us, this wasn't consistent across the board, and many local actors struggled to access direct funding. Quite Andy, there was no change in getting more direct funding to local actors. Jameel pointed out that the funding process is too complicated, even though most of the local actors have the capacity to absorb funds. And this point was also echoed from the floor as well. I've only got a minute, so is that really a hard deadline? Could I? It's 12:30 right now. Okay, so let's go to regimes. I'm going to just try and summarize where we are now. So let's go to regimes. There's a lot of stuff around the global humanitarian response plan, concentrating the funds in the hands of dominant actors. Andy pointed this out, not trusting local actors who could manage significant amount of direct funds. We saw a need for a necessary risk appetite, which we've heard from several people here today. Andy told us about the importance of understanding risk from a local perspective. So did other people. Marina said there's a complicated message to send out in the public domain. I'm going to rush on. I could say more, but I've run out of time. Conclusions. So, you know, the main conclusion here is that because of the inherent structure, culture, and modus operandi of the international architecture, the expansion of local action was unable to add up to a real tipping point. Alix said, even though we have the tools, we didn't do it. So at the level of the UN, this is what needs to happen in between crises. There needs to be more work on designing global humanitarian response plans. That's really clear. Marina spoke about leadership models as well. At the level of donors, the donor community needs to review its risk threshold and ability to incentivize new models. Mireia talked about the multi-partner trust fund. At the level of the NGOs and the Red Cross, there needs to be more looking at adapting partnership models and how to do capacity building. And finally, at the level of the research community, we need to demonstrate the feasibility and viability of locally led response in a way that speaks to the priorities and concerns of those who currently hold the purse strings. So the final thought from Marina, let's be humble. It's not just about the international system, it's about local actors. And so I hope this little framework is very rushed. You can tell I'm speaking very quickly and I'm ending. I feel the pressure to finish. I'm going to do it. I hope it gives us a more complete understanding at 3 levels of what happened, why it happened, what needs to happen next. So thank you very much for listening.
Thank you very much, John. And impressive that you were able to bring all of that together and summarize that in the framework. And it'll be interesting to see how ALNAP and or others use that analytical framework moving ahead. So thank you for saving me having to do a summary, because you've done that all. The only one I would add is to make sure that maybe those evaluations on the development and humanitarian sides come together. So we look at how the international system is doing from the perspective of local actors. So really that flipping the system in a way. Huge thanks to all of you online and in the room who participated in terms of questions and also just being here. Huge thanks to our panelists, Lori for opening us up, Andy, John, Jameel, Alix, Mireia, and Marina. I think I highlighted a lot of things that maybe aren't new, but it is really an opportunity for us to reflect on how do we start to make some of those changes so that we can really make that shift towards localization being put into practice. Also, thank you to the technicians at CICG and to ALNAP colleagues behind the scenes for running everything, and to those who helped organize HNPW. I wish you a great rest of the week. Thank you very much. And sorry for being 3 minutes over.